You are walking past a post-op patient's room when you notice something is off. The patient is out of bed. He's shaky, clutching to the IV pole while trying to get to the bathroom. There is no call light, no bed alarm, just you and a fall risk waiting to happen. I'm Dr. Perney, and I am going to take you through what clinical judgment looks like in a situation like this. Falls remain one of the most preventable in-hospital events, but it takes more than a yellow bracelet. It takes clinical judgment. Let's walk through this scenario using the clinical judgment measurement model. Mr. Bellamy is 74, post-op from a right hip replacement. He's alert, but he's on oxycodone. He tried to go to the bathroom alone. You found him shaky, clutching that IV pole, and his bed alarm was off. Before we move on, pause and think. What may be going on with this patient? What cues stand out to you? And where would you begin in the CJMM process? This is your moment to practice thinking like a nurse. Let's break this down. We will start with recognizing cues. The most obvious ones would be weakness, opiate sedation, and bed alarm off, while attempting to make a transfer that was unsafe. Next up is analyzing cues. This patient is a high fall risk. He did an unsafe mobility attempt, and this is an urgent matter. Now we need to prioritize our hypothesis. Patient was an imminent fall, he was unaware, and there was a communication breakdown amongst the team. Now we need to generate solutions to prevent a future fall. We need to re-educate the patient, make sure the alarms are on, include hourly rounding, and make sure the team is included on the plan of care. Now let's take action. We need to activate that bed alarm, reassess if the patient needs a PT and OT evaluation. We need to document that near fall. We need to update the team on the interventions that are required to keep this patient safe. Now, once we've done all that, we will need to evaluate our outcomes. Did our changes prevent a reoccurrence? I sure hope so. Make sure you keep the team updated as well. Let's put your practice to action. What's your move? A. Call the provider to request a sitter. B. Ask the CNA to check hourly. C. Re-educate the patient and turn the alarm on. Or D. Post a fall risk sign. If you've answered C, it addresses the immediate risk and it uses clinical judgment. Way to go! Fall prevention isn't just a checklist, it's clinical judgment in action. Use the clinical judgment measurement model to protect your patients and prevent harm.